So last time we covered in gross anatomy lectures the topic of sacral plexus, lumbar plexus, an overview of the differences between the upper limb and the lower limb. Today we shall be starting with osteology of the lower limb and the very first bone, which is a very important bone in the background of its location, in context of its location, since it is located in the pelvis region of the body, which is the region that lies between the body, upper trunk, and the lower limbs. So this bone is called hip bone. It has several other names, which include the innominate bone. Innominate means nameless, no name. It is also often referred as pelvic bone, os coxae. Os coxae is a term derived from the Latin language, and coxal bone refers to the pelvic bone which connects the trunk with the lower limb. Both of these words, os coxae and coxal, they are derived from the Latin language, referring again to hip bone. Hip bone is a very large, irregular bone, as you can see in this picture. It is in itself comprising of three parts, which develop as independent bones and later fuse with each other at the region called acetabulum, this one. So the superior, thin, flat part of the hip bone is called ilium. The thick postero-inferior part is referred to as ischium, and thin antero-inferior part is called pubis. We can further see each of these parts. Here in this diagram, each of the part is colored or is assigned a different color. The superior thin part of the hip bone is called ilium. The thick postero-inferior part is called ischium, and thin antero-inferior part is called pubis. So as any other bone, any other paired bone in the body, most of them we studied in the upper limb, they were paired bones. Hip bone is also a paired bone. It forms pelvic girdle on both sides, right and left. So since it's a paired bone, we need to know its anatomical position and side determination. To understand the anatomical position of hip bone, we can take into consideration a few points, a few bony features of the bone. For example, if we see this picture here, this thin flat part, we named it earlier as ilium. Ilium superiorly is bounded by a convex border called iliac crest. This iliac crest has an anterior limit and a posterior limit. Since it is directed superiorly, so it can give us, or it can help us out to understand the anatomical position. So we need to keep this iliac crest superiorly while holding the hip bone. Second point that we can take into consideration is the laterally placed acetabulum. In this diagram, you can see acetabulum is directed laterally or almost posterolaterally. Acetabulum is important in reference to the formation of hip joint because it's a hollow area, it's a hollow fossa, and this hollow fossa called acetabulum receives the rounded head of femur to form the hip joint. Also, this very site is the union of the three bones that form the hip bone, which is the ilium, thick postero-inferior ischium, and thin antero-inferior pubis. So this acetabulum which is the hollow fossa, is directed laterally or posterolaterally. So we need to place the iliac crest superiorly and second point acetabulum to place it posterolaterally while holding the hip bone. Third point that we can take into consideration to understand the anatomical position of the hip bone is obturator foramen. Obturator foramen is supposed to be located below the hollow fossa acetabulum, and it is supposed to be bounded anteriorly by the thin pubis and posteriorly by the thick, strong ischium. So obturator foramen can be a third point which we can take into consideration to understand the anatomical position of the hip bone, how to hold the bone correctly anatomically. So the first point that we took to understand the anatomical position of the hip bone is iliac crest. As I mentioned earlier, iliac crest is the superior most limit of the thin flat part of hip bone, which is again directed superiorly, called ilium. Iliac crest makes the superior boundary of the ilium. It is thick convex border limiting superiorly ilium. Second point that we can take into consideration to understand the anatomical position of the bone is acetabulum, which is a hollow fossa. This fossa is located laterally or posterolaterally to receive the head of femur to form hip joint. Third point is the obturator foramen. Obturator foramen is located below the acetabulum and is bounded anteriorly by the thin pubis and posteriorly by a strong, thick ischium. Next thing is to understand how to determine the side of the hip bone. Either it belongs to right side or left side of the body. To understand side determination of the hip bone, we again need to know some bony features of the hip bone. So first of all, as I mentioned earlier, iliac crest is bounded anteriorly by a spine, by a very sharp bony projection called anterior superior iliac spine. And posteriorly by a similar, less sharper projection called posterior superior iliac spine. Next point to understand the side determination of the hip bone is pubic bone. As we will study further on, we shall study the different bony features of the pubis, and we will come to know that pubis further comprises of rami and a body. So this is the body of the pubis, which is basically forming the anterior boundary of the obturator foramen. So this body of the pubis, it is supposed to have two surfaces. The pelvic surface of the body of the pubis, this entire aspect of the hip bone in this picture is showing the pelvic surface of the ilium, pubis, and ischium. And this diagram is showing the outer surfaces of the ilium, ischium, and the boundary of the pubis. So, pelvic surface of the pubis should be placed so that it faces backwards and upwards. Third point is to understand the location of the pubic tubercle. Body of the pubis superiorly has a bony projection called the pubic tubercle. This anterior superior iliac spine and this body of the pubis, which articulates with the body of the pubis of the opposite side to form pubic symphysis. This one is the symphysial surface of the body of the pubis, which is going to articulate or join with the symphysial surface of the body of the pubis of the opposite hip bone to form the pubic symphysis. So, anterior superior iliac spine and the symphysial surface of the body of the pubis. And in some books, pubic tubercle is mentioned. Both of these bony features or bony landmarks of the hip bone should lie in vertical or coronal plane while holding the hip bone. Fourth point that we can take into consideration to fully understand the side determination of the hip bone is this notch. This big U-shaped depression just below this ear-shaped surface of the ilium is called greater sciatic notch. It is labeled in this diagram as well, greater sciatic notch. And as you can see, greater sciatic notch is located laterally. So while holding the hip bone, you will hold the hip bone in the first web space of your hand. Here is another diagram in order to understand the anatomical position and side determination of the hip bone, taking into consideration the different parts of the hip bone and their surfaces. So this is a complete diagram showing a complete pelvic girdle. As you can see, the pelvic girdle is formed on either side by the hip bone. Hip bone anteriorly is joined at the pubic symphysis by the two pubic bones of either side, right and left. This aspect is showing the pelvic surface of the ilium. Superiorly, ilium is limited by a thick border which is convex and directed superiorly, extending from anterior superior iliac spine till posterior superior iliac spine called iliac crest. Then we have a lateral acetabulum, and below that we have Obturator foramen, which is bounded anteriorly by a thin pubis and posteriorly by a strong, thick ischium. Today we shall be covering the bony features of ilium. We discussed earlier that ilium is the uppermost or the superiormost part of the hip bone. It is limited superiorly by a thick border, also called a ridge, named as iliac crest. And inferiorly, it forms at least the upper 2/5 of the acetabulum. Because acetabulum is also, it is not only the region that is going to receive the rounded head of the femur to form the hip joint, but it is also the site during the development of the hip bone where three parts of the hip bone, namely the ilium, posterior-inferiorly ischium, antero-inferiorly pubis, join to form or fuse with each other to form a complete hip bone. So hip bone, ilium, naturally forms the upper 2/5 of the acetabulum. So it has these parts, iliac crest, upper 2/5 of the acetabulum, lower part, and three borders, anterior, posterior, medial, and comprises of three surfaces, gluteal, iliac, and sacropelvic surface. Iliac crest is a concavo-convex upper thick ridge limiting the iliac fossa superiorly. It has two ends which form its anterior and posterior limitations. The anterior end is called anterior superior iliac spine, whereas the posterior end is called the posterior superior iliac spine. Iliac crest has a highest point, which is a little behind its midpoint. This highest point lies at the level of L3 and L4 lumbar vertebra if a horizontal line passes through it, joining the highest point of one hip bone of one side to the highest point of the hip bone of the other side. Also, the iliac crest is divided morphologically into at least two divisions. A long ventral division or anterior division and a short dorsal segment. So there are two morphological segments of the iliac crest. A long ventral segment and a short dorsal segment. The ventral segment further comprises of an inner lip and an outer lip. And in between these two lips lies the intermediate area. The outer border of the ventral segment of the iliac crest shows a projection called iliac tubercle, which almost lies 5 centimeters from the anterior superior iliac spine. The ventral segment of the iliac crest forms more than 2/3 of the iliac crest, and the dorsal segment is shorter in length as in comparison to the ventral segment. Ventral segment, as I mentioned earlier, has two lips with an intermediate border. The dorsal segment has a medial and a lateral slope, divided by a ridge. Now we come to the borders of the ilium. Ilium, some mention that has 3 borders, and other authors mention that ilium has 4 borders. The 3 borders include anterior border, posterior border, and medial border, whereas the 4th border is considered to be the iliac crest. Anterior border extends from the anterior superior iliac spine up to the upper part of the acetabulum. It shows anterosuperiorly the anterior superior iliac spine, and below, almost in the middle, anterior inferior iliac spine, which is just like anterior superior iliac spine, is another bony projection below the anterior superior iliac spine. And in between these 2 spines is a rough, less deep, notched area. Posterior border runs from the posterior superior iliac spine up to the posterior border of the ischium. And in its way, it shows superiorly, just like the anterior border, posterior superior iliac spine, posterior inferior iliac spine. And below the posterior inferior iliac spine, we can appreciate a very large, deeply placed notch called greater sciatic notch. This notch in the lower part leads to another bony projection called ischial spine, and below that we have a lesser sciatic notch just above the ischium. Medial border is the one that is present on the inner or the pelvic surface of the ilium and separates the iliac fossa from the sacro-pelvic surface of the ilium. So this one is the medial border extending till the iliopubic eminence. Now coming to the surfaces of the ilium. Ilium has 3 surfaces. Gluteal surface, the name is indicating, it faces the gluteal region of the lower limb and gives attachment to the gluteal muscles of the same region. Then we have iliac fossa, which a layman may also call flank. This iliac fossa is also called the pelvic surface of the ilium or the inner surface of the ilium. And the third surface, we have the sacro-pelvic surface, which lies